Today, we're going to talk about cannabis rescheduling. As everyone knows, there has been a lot of news about this lately, and I'm going to break down today the implications of that and how that affects medical practices. Cannabis rescheduling, what every doctor needs to know. Now, currently, cannabis is Schedule 1. That means there's no acceptable medical use, there's a high potential for abuse. It is viewed as illegal. It's the same category as heroin, LSD, MDMA. It is a crime in many places to use cannabis. Now, this was enacted in 1970s by Nixon, and if you look into the history, there's a lot of political reasons that this was done rather than actually medical reasons. Hemp now was exempted from Schedule 1 back in 2018 because of the Farm Bill. And there's a loophole in that Farm Bill that allowed for hemp derived THC, such as the beverages or Delta 8, to exist. And though in November of 2025, Congress, as part of a recent bill, banned these hemp derived THC and Delta H, and that's going to go into effect in 2026. I am Dr. Janice Makela. I'm a physician with over 20 years of experience. I'm board certified in geriatric medicine, hospice and palliative care, internal medicine. I am a hospital medical director, and I'm your guide to physicians learning about the endocannabinoid system and cannabis. Now, let's talk about the timeline. In 2013, 2014, the Cole Memorandum came out, and that basically says that Justice Department is not going to interfere with state cannabis laws. California by that time had been doing legal cannabis for medical reasons since the mid 90s, and other states had been following suit. And so in 2013, 2014, there was the Cole Memorandum and then an amendment that actually prohibited the Justice Department from going after the states for their laws. Now, in 2022, Biden first started proposing rescheduling. It really didn't get going until 2023, but then in January of 2025, it pretty much halted to a standstill, with the DEA kind of saying, we're pausing this. And there was a lot of different reasons they said, but basically they stopped that. Now, then in December of 2025, Trump signed an executive order saying that we'd be rescheduling cannabis. Now, this did not make it a law yet. It just enacted that the DEA needs to expedite things, that Department of Justice needs to, and everyone else who needs to chime in needs to work quickly to have this done. And so in December of 18th, he signs this executive order. It is Schedule 1 to Schedule 3. So notice it's not Schedule 2. That's morphine. That's a lot of other cocaine is actually Schedule 2. And it actually makes it Schedule 3 because it recognizes that, unlike morphine, you can't die of an overdose. Unlike cocaine, it's not as harmful. It's still scheduled. It still needs to be prescription, but it's now legal under Schedule 3. Now, there was also, as I mentioned before, Congress had talked about hemp, and in that there was a full spectrum CBD. And he made kind of a big deal of this in his presentation. And it's even stated in his executive order that full spectrum CBD, that Congress needs to define what that means, and it needs to be exempted from bans on hemp-derived THC, because full-spectrum CBD has just a little bit of THC, but enough that it was getting caught up in this ban. Now, separately, Trump also said that Medicare would pay for CBD. That wasn't actually in the form he signed, but he did start talking about that. We haven't seen that happen yet or how that's going to happen, but that is a thing. The executive order does not make this happen immediately. I can't stress that enough. Again, he's instructing the DEA, Congress, Medicare to make these changes a priority. And it's really unclear how long this will take, whether the DEA will stall things like they did with Biden, or whether Trump will kind of push it through. We will see. But if it does, what changes will be happening with Schedule 3? Well, first, cannabis will be recognized as a product with medical use. It allows pharma companies to make prescription cannabis. Cannabis companies, even the dispensaries, the growers, everyone, even in the state cannabis programs, can now get tax benefits because Schedule 1, making it fully illegal, meant that anything that had anything to do with growing or selling of cannabis was illegal. And so the tax write-offs, people would do stuff, but they couldn't write off it for taxes. They had to pay the taxes on it, but they couldn't write it off. This also makes research easier, and it means that doctors can prescribe it. Also, it means that there might be a time when at least the prescription cannabis can be in hospitals and hospices and other things for inpatient for people who need it. Now, what it doesn't do, it does not make dispensaries legal. Those would still be sort of out of the description of Schedule 3. It does not allow people to grow their own cannabis. In a state where it's illegal, you could still get in trouble for growing your own. That would be like making your own pain medicine, right? It would be considered illegal. It doesn't remove criminal laws. That's actually a different law that needs to change to actually make it non-criminal. And it's still kind of unsure whether insurance or Medicare will pay for dispensary cannabis or even CBD. They may have to pay for prescription cannabis if a prescription actually happens and a pharma company comes up. They may have to pay for that. But dispensary cannabis or over-the-counter CBD, yeah, again, Trump is trying to pass the law to make them pay for CBD, but maybe not. Now, will companies even try to get FDA approval? I actually hear this a lot. I hear people say, oh, but the FDA is built so that cannabis can't actually exist as a medicine. They're all big onto single drugs and something like a plant you can't sell. Well, actually, there are companies. There's already a couple companies seeking FDA approval. And a U.S. company for full spectrum CBD is in phase 2 trials for autism behaviors in children. Another U.S. trial is looking at Huntington's, Parkinson's, and MS. And a German company recently announced it's seeking FDA approval for full spectrum THC in 2026 for chronic back pain. More are likely to come. Now, once a drug is FDA approved, it is allowed by doctors to prescribe it for indications that are not part of the FDA approval. This is called off-label uses. We do this all the time with a variety of other medications. Now, states have many conditions that qualify for their marijuana program. And many qualifying conditions are based off of consensus rather than research, but many others have good research behind them. And patients are going to start asking for their conditions. Doctors need to know which conditions can really benefit and which cannot. FDA guidance may not be enough because not every strong indication is going to get FDA approval. For the same reason that pharmacies do this with other medications, they're likely not going to get FDA approval for everything that cannabis can potentially help with. So physicians are going to need to know which off-label indications can help and which are perhaps better not used. Now, this executive order changes people's perceptions. People will take it as federal approval. People will take it to assume it's safe, and appropriate and inappropriate uses are possibly going to increase. Patients may be more open to talking to their doctors if they feel it's safe doing so. So, if you present yourself as let's talk and you're non judgmental, they may start talking to doctors. The data says they haven't been. Patients may have a lot more questions for their doctors. Being viewed as a medicine, people might actually start coming to their doctor instead of the dispensaries. Now, some patients still may go to dispensaries. They may prefer the formulations that the dispensaries have, but they're still going to have questions. Now, currently, most patients don't talk to their doctors about cannabis, but they need to. In one study, 25 to 30% of patients use medical cannabis in a legal state. Less than half inform their doctors. And a lot of times, this is fear of judgment, fear of legal consequences. This can lead to drug interactions, misdiagnoses, and other complications because the doctor doesn't know they're on cannabis and they possibly might be giving them something that could interact. Some patients without guidance might be using too much and even develop complications such as cannabis use disorder or cannabis hyperemesis syndrome. Now, part of this also is that doctors were taught to treat cannabis as a drug of abuse, not as a medicine. We've learned the harms of cannabis. We've learned about cannabis use disorder and possibly even about cannabis hyperemesis syndrome and how to get people to stop using. But we have not been taught dosing, formulations, or indications. We have not been taught drug interactions, contraindications, or specific risks. We have not been taught the different pharmacokinetics of different formulations, and we have not been taught the different effects of THC and CBD in a balance. So the actual products and the interactions of CBD and THC play with each other. And so that ratio makes a difference, whether it's a high THC product or a high CBD or equally balanced. We have not been taught about the endocannabinoid system and how cannabis affects it. So there's a lot of things we don't know. So the question is, are you prepared for these conversations? Because these conversations are coming. If your answer is no, if you're thinking to yourself, oh, I just send them to the dispensary, or I don't really know how to talk to them, this is why I have created my Clinical Cannabis Mastery Program. This is for physicians who want to elevate their knowledge of cannabis medicine, not so much as a cannabis doctor, but as a doctor who deals with patients who use cannabis. Reach out if you want to learn how you can better care for your patients who use cannabis. I can help.